Greetings, everybody. I'm Priyanjali from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. Welcome, everyone, to our special Instagram live session. In this live, we will be shedding light on a condition that affects millions worldwide. Acne isn't merely a surface issue; it can deeply impact one's emotional well-being. Beyond the physical blemishes, it can erode self-confidence, leading to anxiety, depression, and social withdrawal. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. Yet, despite its prevalence, there are still widespread misconceptions and stigmas surrounding acne. That's why today's live, we are aiming to dispel myths, promote understanding, and empower individuals to seek effective treatments. Today, we are diving into the topic acne management with our skin expert. Whether you are struggling with breakouts yourself or simply curious about maintaining clear, healthy skin, this session promises to be both informative and engaging. Today, we are honored to introduce Dr. Rohini, a renowned skin expert from Kashipur. Dr. Rohini Soni is a highly skilled consultant dermatologist practicing at KVR Hospital, Kashipur. She holds an MBBS from Government Medical College, Amritsar, and an MD in dermatology, venereology, and leprosy from ESI PGIMSR. Delhi. With a commitment to advancing dermatological care, she specializes in diagnosing and managing a wide range of skin, hair, and other disorders. Dr. Soni is an active member of the Indian Association of Dermatologists, Venerologists, and Leprologists, IADVL, and the Association of Cutaneous Surgeons of India, ACSI. Her expertise extends to academic contributions, having served as both an author and reviewer for numerous reputed medical journals. This involvement underscores her dedication to evidence based practice and continuous learning. Known for her patient centric approach, Dr. Soni combines her clinical skills with empathy to provide tailored solutions for her patients. She stays updated on the latest advancement in dermatology and incorporates modern techniques and treatments in her practice. Her work reflects a commitment to excellence in both clinical and outcomes and patient satisfaction. Today, we are privileged to have her with us, and she will be sharing insights on acne and its management. We extend our heartfelt gratitude to you, Doctor, for joining us today. Without further ado, let's dive into the first question, which is what is acne and what are the types of acne lesion?
Actually, acne is an inflammatory condition. It involves the pilosebaceous unit in terms of medical, if we say. Pilosebaceous means that is the sebaceous glands or the oil glands which we have on the face, which encircles the hair follicle. So inflammation of that unit leads to acne formation. Now there can be multiple types of acne. If we are talking about the milder condition, it can present with in the simpler terms such as with white heads or black heads, sometimes small red inflammatory nodular lesions, small pus-like lesions, which is also known as pustular lesions. So it can present in many ways, and acne usually have multiple types of lesions in having in the same condition. It means that talking about the types of acne, sometimes we also see that there are patients who work in the extremely hot and humid weather. In that condition, if we say it acne mechanica. If some patients which have acne due to some hormonal issues, so that we name it as a hormonal acne, and it usually involves particular sites due to which we can understand that which type of acne it is.
Right. Uh, Now, moving ahead, Doctor, how does the initial stage look like? I mean, there has to be a starting of it. What are the early symptoms? How does one know that this is the time to go to visit the dermatologist? Because it's always easier to get cured in the initial stage.
Actually, most of the patients who have acne usually around the age of around 13, 14, and it can extend up to the age of 20s. Initially, we
Hmm.
have just slightly irritated few papules or few boil-like lesions which can appear on the face. Sometimes
Hmm.
patient try to treat it with some local medication, and further it flares that condition further and leads to pus-like lesion. So it is always better, even we have smaller lesions or fewer lesions, first we should visit some specialist to ask for it, okay, what we can do, because applying betnovate simply or some over the counter products can lead to further flares, which can lead to acne scars as a complication, and where they are very difficult to treat.
Right. We will talk about the self-medication part as well. But for now, let us know, doctor. We see a lot of people, popping a pimple whenever it's on the skin, um, because we normally do not like our skin with pimples. We do not like seeing it like that. So, how harmful can that be? Popping the pimple. We usually visit the parlor for facials and lot many skin treatments. Uh, Also, the parlor wali didi, we also see her, popping pimples or taking out blackheads. So, can those also have an adverse effect on the skin?
Yes, yes. Popping of pimples can lead to a further inflammation of the area, leading to acne scar formation, which we have seen many patients who come with a gaddha on the face, which shows that the
Mm,
acne was popped out and all the material was taken out, due to which there was a scar formation that is lifelong. So it is better not to
mm,
pop that area. Further inflammation around that area, it's very painful if we pop it. It's always better to treat it, not to pop it. I always recommend my patients that do not scratch it, it can lead to scar formation. Do not pop it out, just be patient and use medications, and slowly it will fade away.
right. So, which are the usual areas where we normally get to see the lesion occurring?
Actually, it depends upon the types of acne. If we're
Mm,
talking about teenagers, it is mostly seen around the cheek area. When we talk about
right.
the adult people coming around 40 years of age, it is usually seen around the jaw area. And most of them have hormonal influence, due to which the acne is occurring. So, jaw is the
Mm,
area in which, if we have a full clear face and only jaw area is involved, it is
mm,
90% I'm sure that the patient is having some hormonal issues, due to which it is coming
right.
out. Similarly, in PCOD like conditions, the area of involvement of acne is mostly the jaw area. And
Mm-hmm,
otherwise, sometimes the whole of the face is clear, but only forehead is involved. And in that
right.
condition, too much of oiling is there, or some seborrheic
Mm,
dermatitis like condition is associated, due to which acne is coming. So, according to the area, it is very easy for us to judge that what type of condition is aggravating that acne.
right. Speaking about the forehead area, we normally get to see boys or men in their late 20s having such. What is a seborrheic dermatitis, if you would like to elaborate that for our viewers?
Seborrheic dermatitis is usually, in the simpler terms, we call it as dandruff, but it can
Hmm.
range from few scales over the scalp to the thick plaque-like scales that is
Mm-hmm.
adherent to the skin. So, seborrheic dermatitis usually it is associated with too much of oiling sometimes, which is leading to
Right,
further fungal growth, and that fungal
right.
growth then comes down over the face, it leads to further pustular or papular like lesions. Mostly the forehead area is involved, sometimes chest area is also involved. If the patient is
Mm-hmm.
coming to us with forehead and chest acne, most of them has seborrheic dermatitis.
Right, right. Now, doctor, speaking of oiling the hair, you mentioned nowadays we get to hear a lot from our dermatologists that please avoid oiling. Uh, we have not been grown up like that. We have always had so much oil in our hair that we do not need body oil for that. We can just swipe it off our hair and then apply it in our body, uh, being from the Indian society. But nowadays, there why such change that all the dermatologists are asking us to avoid oil, strictly to avoid oil? Why this change all of a sudden?
Actually, it is not a change. Earlier, usually people do not visit doctors for just seborrheic dermatitis or acne. Earlier,
Hmm.
the patients were not concerned much about the cosmesis or aesthetic looks of them. So that is why the Dadi
Right.
Nani was oilier hair. It is very good for health. So we do it.
Hmm. Hmm. Hmm.
But oiling is actually just taking away the dryness. It will not give you any nourishment. It will just it will not let your hair dry. So I always recommend not to oil your hair, but if you still want to oil, just do it half an hour before the head wash and then do it. And the conditioning part you
Right.
want, which you want from the oil, it will come without giving the side
Hmm.
effects.
Right.
Because too
Right.
much
Now
oil,
coming back.
accumulation of so much scales, as well as growth of many fungal lesions, because we live in humid environment. So
Hmm. Hmm.
fungal growth
Hmm.
in the oily area, humid area is very common.
Right. Right. Coming back to the same point again, we are talking about acne here. Doctor, what are the grades of acne?
Medically, it is said to be having four grades: grade one, two, three, four. Grade one is milder acne, which has only whiteheads or blackheads. Uh, Grade two is papular acne with whiteheads, blackheads in combination with few bump-like lesions over the face, which is reddish in color, slightly painful maybe. And in when we move towards grade three, it is more moderate to severe form of acne with pustule, combination of pustules, papules, which is the number of which is coming more than 40. And coming to grade 4, it is also known as nodulocystic acne. When the patient is coming with inflamed face, mostly nodules or hard boils over the face, sometimes bridging between the two boils is also seen. It is known as nodulocystic acne, and it is very difficult to treat.
Hmm. Right. Now coming back again to the next question, let's know about the treatments which are available currently for different grades of acne.
Actually, milder acne doesn't need much treatment. It is just improving the lifestyle if something is wrong. And apart from them, some topical medications such as benzoyl peroxide or some topical retinoids such as adapalene or tretinoin can work very well in mild to slightly moderate acne. But if pustular, matlab pus-like lesions are involved, then we have to give a short course of sometimes some antibiotic like doxycycline. And if the case is very severe and it is not, then it is not going to go with such simple drugs, then we have to start isotretinoin. Isotretinoin is a very important and very good drug when we talk about acne. It will improve even nodulocystic acne very well if taken in a good amount.
Right. Um, Doctor, what are the procedures available for acne treatment?
Actually, usually I start with only medication only, and then if we find that the medications are not working and the patient wants the treatment faster or results faster, then we ask the patient for chemical peeling. Salicylic acid peeling and Jessner's peel are very good peels for acne. Salicylic acid peel works wonder in case of comedons or blackheads. We punch out the blackheads with the instrument and then apply salicylic acid peels, and it really improves in next 10 to 15 days. And apart from then, sometimes IPL laser is also done when there are a lot of erythema is there when we do the IPL laser. And another group of procedures are available when acne are gone but their scars and pigmentation is left. For pigmentation, again, we can do glycolic peel or other types of peels. And for other important complications such as the scars, we can do TC spot TCA, which is the application of some chemical over the acne scars so that it can build some collagen and comes up. And apart from then, we can do MNRF is a technique which is used for acne scars. Microneedling is another technique which is used for acne scars, and sometimes PRP is also added to that. So there are so
Right.
many procedures which are available, and it is usually customized patient to patient, that what that patient needs.
Right. Now, let's talk a little bit about skincare. We get to see the importance of skincare in our life in today's society. I mean, there is a certain hype amongst everybody. May it be an adolescent, may it be an adult, everybody is very much conscious regarding the skincare because of the hype created in social media or whatsoever. Um, you mentioned about blackheads, so we get those blackhead tapes which we apply on the nose and then we peel it off. People normally does it at home only. They do not visit the dermatologist for it. Glycolic acid you mentioned. We get acid in our toners, or salicylic acid we also apply we get in our skincare. Azelaic acid we get in our skincare. So why visit a dermatologist when everything is available in market? When we get everything in social media, why visit a dermatologist then?
Actually, social media has done a lot bad, because patients coming to us usually has done everything on their own, and then they ruin
Hmm.
their face and then that we have that type of issue which has developed due to medication which we have done. Otherwise, earlier it was not that bad. So social media may be good, but in that case, over the counter medication prescription, all the products available to the patients, not knowing what is the harm that product can do. Everybody is using everything. I think it is not good. Coming to the
Hmm.
doctor will help you that what type of product you need, plus the prescription, that the products which are coming in the market like that, they are very low concentration products, 1%, 2%. Sometimes that is not working for them.
Right.
So we prescribe the percentage that is correct for them, and the precautions that has to be done along with them, such as I usually give adapalene and ask the patient just apply on the spots of the acne. Start with 30 minutes, then wash it off. After few days, apply for 1 hour, then wash it off. The social media will not tell you about that. Okay, what you
Right.
have to do and what you don't have to do, and what precautions are
Mm-hmm.
to be taken along with the medications. Because every
Right.
retinoid and every acne treatment will lead to dryness. And that dryness is very severe. It is known as retinoid induced dryness. It is very severe. We will have chapped lips, dry, scaly skin. So, skincare is important part of acne treatment. So you have
Mm-hmm.
to apply a good face wash, which is I think should be salicylic based for acne patients. And apart from them, a good moisturizer has to be given, which is non-comedogenic written on that. And
Mm.
apart from that, a good sunscreen is also required if we want to treat our acne without leaving a black mark.
Right. Right. Because we started talking about sunscreen, and what is the importance of sunscreen in our society, or is it just a marketing gimmick? Again, we have never grown up applying sunscreen, but nowadays it's very much important for every single person, even they're outside, even they're indoors. Sunscreen is a must. So is it really important for us?
I think so. No dermatologist will say that sunscreen is not important. Sunscreen is very, very important. A lot of studies has been done in which it has been shown that applying sunscreen will actually decrease the aging process. It will
Mm,
further
mm,
increase pigmentation over your face. Even if you just apply a moisturizer and sunscreen and look your face 6 weeks apart, there is a slight difference that a patchy skin is not there, uneven toning is not there. I don't believe in so much of steps. I just believe that apply a good moisturizer, apply a good sunscreen. That is all. Nothing is required if you don't have any other problem. And if you want to
right,
apply something, don't just scroll the Instagram and apply vitamin C serum as well, retinoid as well. Do this, do that. Everything is not for everybody.
right. Right. Now, choosing the sunscreen also becomes a task for us. How do we choose the right sunscreen for our skin? For people with a tendency of having acne, or also for people who are suffering from acne?
Every patient who's having acne should apply a sunscreen which is has it on it gel based sunscreen or lotion based sunscreen, and it has it written on it non-comedogenic means it will not flare further acne, it will not disturb your acne, it will not lead to the aggravation of the condition you are having. Apart from that, it will provide you a skin protection, that is when your acne heals it will not lead to black marks. So constant applying of sunscreen will give you some improvement over the period of time. And for choosing it for acne patient, I think gel based sunscreen is always good,
Right,
because gel
right.
means water
Also,
based. Water based sunscreen will not lead to further aggravation.
right. Uh, also, how do we apply our sunscreen? We do not know how to apply, and if we have a skincare regime, where does the sunscreen go in the according to the steps?
I think it is very. It is said that it has to be applied every 3 hours. It is very difficult to follow that. So it
Hmm,
is important that the type of work you do will describe that how many times the sunscreen has to be applied. If we are working
hmm,
outside in the field, then it is very important that we apply again and again. And
hmm,
but if the person is having a desk job, then I think it is better to apply before leaving the house and before leaving the office. If you can do that
hmm.
only, that will help. Apart from
Right,
that, I say most of the people who are coming to me who are housewives, I say that please apply it in the morning, and whenever you step out, then reapply it. At least you can do that,
right,
which is very, very simple,
right,
because it is not easy, and nobody is that free that we can apply every 2 hours. It is not easy for the person to apply every 2 hourly. And the person who is going for the beach or vacations, for them it is very important that they apply again and again, because beach vacations will give you so much of pigmentation over the face, so much of tanning, and sometimes even sunburn. So it is better to apply again and again when you are going for such type of occasions.
Right. Now, doctor, for people who are already suffering from acne, they can relate to it. Lifestyle plays a very important role in their life. They need to maintain a proper lifestyle. May it be sleep, may it be food, may it be a regular exercise. These are the few things which they need to take care of in their life. Let's start with food. What sort of food should one normally include in their diet, and what are the kind of food which the patient should avoid?
For acne patients, it is always said that the food which has high glycemic index should be avoided. So foods with sweets, so much of sweets, too much fried food will always aggravate the acne, because such kind of food has pro-inflammatory indications or pro-inflammatory effects. So any we have already have inflammation, we are eating such kind of food which will further increase the inflammation. So any patient who are having any type of inflammation in the body should avoid the food with the high glycemic index. Apart from that, for acne patients specifically, it is said that milk products are also should be avoided, because it contains so much of hormones that can further aggravate the acne.
Right. Now, also tell us, doctor, can stress trigger the condition as well?
Yes, stress can trigger any condition. Any problem you are having, stress can. It is not true for acne only. It is true for any condition. Stress can lead to stress-induced acne, which are mostly seen over the uh, forehead sometimes. And I have seen many patients that they have go to visit. They have to. They are bright for the day, and there is a pimple popping out just before the night because of the stress. So I think stress can induce, because of the increased cortisol levels. It leads to acne formation.
Right. Doctor, what about people who need to apply makeup in their regular day-to-day life? Maybe their work demands it. Can makeup be safe for acne patients? If yes, then what sort of makeup should they normally choose?
Otherwise, if you have too much of acne, I ask patients to avoid as much as possible. But if the patient has some type of job in which so much of makeup is required, then I ask them to use the product which are safe for them. That is, should be a good company product. No, local
Mm-hmm.
products should not be used. Do not use so much of primer. Do not use so much of foundation. Just light something should be applied, and always start makeup first using moisturizer and sunscreen, and clean the makeup as your job is over. Do not sleep with the makeup, and use your brushes, clean your brushes thoroughly. That bad brushes or dirty brushes further leads to acne formation.
Right. Also, does hydration plays an important role here? Can it be contagious?
Hydration is very important, because acne treatment itself lead to dryness. So from outer hydration is that we have to apply a good amount of moisturizer at least twice daily, and for inner hydration we have to have a lot of water, because isotretinoin itself leads to dryness of the lips. So if we drink an ample amount of water, it helps a little.
What about being contagious? Because we normally are very much concerned staying with people who has any sort of
Acne
skin issues.
is not at all contagious. If it is occurring
Right,
to you, it will not happen to your mother or sister. I
right,
have never
right,
seen a patient saying that my I am having acne now. My mother is also having acne. My father. It doesn't happen like
hmm,
that.
right, right. Uh, but can there be a genetic predisposition?
Yes, there are few conditions in which genetically we have some genes which has higher tendency to have acne, but fewer of them are there. But otherwise, most of the people are having acne in the adolescence, and these days hormonal acne are on flare. I don't know
Hmm,
why, but hormonal acne in females are very common these days.
right. So people who are wondering right now that anybody from their families has been suffering from acne and they also might get it somehow. Is there any prevention for it?
Actually, I don't think that they'll. It is definite that they will get the acne. It depends upon skin
Hmm,
to skin. There is no prevention for acne. If you are having it, then there is a
hmm,
treatment. But before having
right.
acne, you can't prevent it.
Right. But can having a healthy lifestyle or a healthy diet
Obviously,
somehow,
obviously, They go somehow a little bit, but I cannot say that
Hmm.
do not eat this, do not eat that. You will not have acne. It is not like
Hmm.
that.
Hmm.
If
Hmm.
you're having acne,
Right.
it is due to the pilosebaceous unit which is involved, and it is due to the hormones that are involved. It is not only due to food. Food will act as a complementary half. Will have a complementary action. That if you are having acne, you want to reduce it. Don't eat this thing. Then it will further decrease the flare. But but only lifestyle will not improve it.
Right.
But it is not a
Doctor,
guarantee
what?
that you will.
Right. What about people with sensitive skin? It becomes a huge problem for them, starting from the choosing the right product for their skin, or whatsoever. Everything becomes very a little bit tough for them. What about acne? Does acne look a little different for them?
Actually, patients who are having sensitive skin will have issue with every product. So I recommend them to use some milder products, mild cleansers. Do not use harsh products at once on their face. Just start with mild cleansers, mild moisturizers, simple non-comedogenic, and sunscreen. Do not apply a lot of things, and apply only the products which are recommended to you by the doctor if required. And apart from that, the other thing you were saying, that the acne itself leads to sensitive skin, because patients are having so much acne on their face, they think that everything I apply leads to further acne. So I think
Right.
acne further leads to sensitive skin. This is one and the same thing actually.
Right. Uh, Tell us, doctor, is there any health condition which can trigger acne? Anything, thyroid, any autoimmune disease, diabetes. What about diabetic patient? Does acne look a little different for them as well?
No, diabetes I don't think has a direct role over the acne, but yes, PCOD is the condition which can lead to
Hmm.
acne and a lot of acne.
Right.
PCOD is
Right.
one of the most common thing which we see today, which are having acne, and sometimes higher testosterone levels can also lead to acne. Patients who are going to gym and having supplements for their testosterone boosting, they have a lot
Hmm.
of trouble. So I
Right.
think that these are the conditions which leads to acne. Directly, thyroid and diabetes have not been related much with it.
Right. Let's talk about self-medication as well. Normally, we visit the chemist. The chemist will give us any steroidal creams. How harmful can those steroidal creams be for our skin?
Steroid creams are very harmful on acne, because application of steroids over the period will increase your one acne to multiple acne, and further it will
Hmm.
sensitize your skin. It will aggravate the condition. It will produce redness over the skin. Erythema is there, and anything you apply after that will lead to further redness. So it is not recommended to any patient to apply any kind of steroid, because betamethasone is the most common steroid the patients are applying themselves. They feel it is working very well because for 2 to 3 days there is slight improvement, and after that it leads to a big flare, which is very difficult to treat with acne medication as well due to steroid. So steroid is contraindicated in acne.
Right. Um, well, we have gone through a lot of questions today, and with that, I can see some questions coming up from the viewers as well. The first question comes from Vaishali, who asks, "How does develop in the body?" Yeah,
Tunkal acne basically, na? Because like acne
yeah.
occurring over the trunk or the body is same, it has the same I think mechanism of action which is occurring due to on the face, because it is involving the sebaceous glands. We have sebaceous gland or the oil glands over the face, over the trunk, so it can occur anywhere. And mostly the people who are having acne over the back usually are associated with high sweating usually.
Right, right. So, what kind of products should they use? Or we normally try and avoid the body. We normally focus on our face mostly, and we just don't care about what's happening in our body. So, can that spread eventually? What are the kind of products we should use?
Actually the percentage of the product is same, but the percentage of the constituent which is in the product is more. For example, we use usually 2.5% of benzoyl peroxide over face, but for trunk we use either 5% or 10%, because 2.5 will not work for the trunk. The skin is thicker, a slight different skin is there over there. Apart from that,
Hmm.
a slight just say we apply adapalene for 30 minutes over the face, but we have to apply for the longer period over the trunk to have the action. So products
Right.
are usually same, but the application time is either increased or the percentage of the constituent is increased to work.
But can the condition be treated completely? Is it possible?
Yes, yes. Yeah, it has to be treated over the period of time. If your patient is asking me to treat it in 1 day or 5 days or 10 days, it is not possible. If patient is coming for
Hmm.
treatment and he says that I want to get it treated, be it 2 months or 3 months, then it works very well.
Right. Right. The next question, doctor, comes from Nitesh, who asks, Doctor, how can I treat inflamed acne?
Acne most of the times are usually inflamed. The treatment is same. It depends upon whether the pus is there or simply a nodule is there. That the treatment depends upon the type of lesions we have. It is not said that everything on the face is inflamed. That is why it is acne.
Right. The next question comes from Rani, who asks, can ice help reduce acne swelling?
Slightly for the period of time for 30 minutes to 1 hour, but later on it will come back because
Right.
there is
Uh,
constriction of the pores. Otherwise, it looks like that the swelling is reduced, but after 1 hour or maximum 2 hours, it will come back.
right. Doctor, is hygiene important for patients who are suffering from acne? I mean, do they need to clean up their face on a continuous basis, or as you said, removing makeup is very much important? What are the other things which people need to keep in mind?
I think that washing your face with a good acne based or salicylic acid based face wash is important because it leads to decrease in the number of lesions. Further, we have to apply the medication at night. We have to go for good hydration because acne medication leads to further dryness, and that dryness can lead to a lot of inflammation over the face. And a good sunscreen. I think this much skincare is important, and otherwise, other hygiene things are not to be done. I think this is much.
Right. The next question, doctor, comes from Pinky, who asks, can microneedling improve acne scars?
Yes, microneedling improves acne scars, but in number of sittings. If we do only single sitting, it will improve for 10 to 20%. But 4 to 5 sittings are required monthly. One sitting in a month, it improves acne scars very well.
So how has the process been done? Process of microneedling. What do we do normally?
For microneedling, there are actually two types of procedures. One is instrument based, one is machine based. The instrument based, we have a derma roller or a pen which have needles over it, which has to be done over the face. There is some bleeding points coming out, and that bleeding point. But basically, what it is doing, we are doing the controlled damage to the face, which leads to collagen formation, due to which the acne scars improve. So that is
Okay.
done machine base. Sorry, the instrument base. The machine base. It is said MNRF, microneedling radio frequency, which means that there is an instrument. When we put needle on in the skin layer, it releases a current as well, which further improves. The intensity of improvement is better with the machine in comparison to
Right.
microneedling. But one who cannot afford machine based thing, microneedling is comparatively cheaper. It can be
Right.
done very.
Right. Doctor, these treatments nowadays, we get to see a lot of people are offering in the market. Maybe a cosmetologist, maybe my nearest parlor is also offering the same kind of treatment. So how do people choose the right person? There is a hype, no, in market. Everybody is like, मैं उसके पास गया था, इतना अच्छा treatment, my face is glowing, and then after seeing the glowing skin, everybody rushes to the place, and this is how it happens. So who is the right person, the dedicated person who gives the yes,
So actually, this is up to the patient. He has to decide what he wants. Most of the
hmm,
patients, which are slightly educated, they consider that
hmm,
I should go to a educated person who is actually concerned with the subject. Usually, a good dermatologist or sometimes plastic surgeons do this. And apart from that, I don't recommend anybody that patient should go to any random person because people may know the procedure, but they don't know the complications. That
right,
is why
right.
I always recommend that go to the concerned person only after seeing their degrees, who they are, from where they have done what they have done. Don't just go to a random person that he is doing it in 500 lesser, so I'll go to him. So I think that is not a good thing, because if complication occurs, it will ruin your face permanently.
Right, right. Well, we had a wonderful discussion on the topic today, Doctor. Before we take a leave, any take-home message for our viewers who has watched us so far?
Okay, for the I will give a take home message for the acne patients. Just eat right.
Yes.
What you can do, uh, skip milk if it is possible for you, because it will decrease the flares, and do a good skincare which just involves the cleanliness of the face. Apply a good moisturizer, apply a good sunscreen, and only apply the medication which is being given to you by the doctor, not by the chemist. If you do this, your condition will improve without leaving any scar, without leaving any pigmentation, over the period of 2 months or maximum 4 months. But if you do apply random things over the face, apply besan, apply chandan, apply turmeric, apply coffee, because people are coming, apply coffee as well. So it will further flare, and you will take the condition to months and years, and further leading to scars and other complications. It is better to treat it first hand only. Do not go for scar treatment, because it is very difficult. It takes a lot of time, a lot of patience, a lot of money.
Right, right. So again, we are saying कि those घरेलू नुस्खाs are not working. Because skin के लिए तो हम जो भी खाते हैं वो हम लगा भी लेते हैं. I have seen people applying केला से लेके टमाटर से लेके खीरा से लेके आलू से लेके सब कुछ skin में जाता है. So we are saying that these things we does not work, and especially for
Because we do not
people who are suffering. Yes,
because we don't know that what thing what because everything has some chemical. Even aloo has some chemical which is leaching out of it. If we apply
right.
it over the face, and if it burns, sometimes a patient has come to me applying nimbu over the face, because she said
Yes.
that the vitamin C is very expensive, nimbu is very sasta. So I have applied it, and there is a lot of burn and sensitivity. She was having pain even touching to it. So I think that is not to be recommended. Another patient has come applying basin over the face, just regular fire and everything has done, and the face was ruined, because we have to give further medication for 10 days, 15 days to treat it. Why doing it? You should not do it.
Hmm. Right, right. So everybody who are watching us, still watching us, please खाने की चीजें please खाइए और आई थिंक वो शरीर के अंदर जाने से ही काम करता है ना कि बाहर से. That was the expert advice for today, and that was Dr. Rohini for us. Thank you so much, Doctor, for your valuable time. It was a very interesting and informative session for our viewers today, and it was great to hear from you. Of course, we look forward to many more such sessions in coming time. Also, thank you viewers for excellent participation. For more information and updates, stay connected to our beautiful Spotless Skin page. Thank you. Stay safe and stay healthy.